Hey everyone, welcome to another Medical Monday video. Thanks for tuning in. I hope your week is going well so far. And today I wanted to discuss a situation that happened where I got to help someone be their advocate. And since I'm not trying to treat or diagnose or tell you what to do, I thought having this example would be great to share. So, back in 2024, my mom was diagnosed with breast cancer, and she had an amazing surgeon. And they ended up deciding to do a mastectomy. And then the surgeon suggested that every 6 months you get a mammogram and then an MRI just to make sure that they're covering all their bases and just check in with her every year. And so that's been the protocol since then. Now, sometime last year, we got the dreaded letter. And that letter is when the hospital tells you that a provider is no longer going to be there. And then they list all the other doctors that are, available. Side note, there's usually a disclosure nowadays, and in my experience, I've seen everything from 1 to 3 years where a provider can't advertise, put their new address, tell old patients, because in some cases, patients would follow the doctor, and the hospital or the medical offices don't want that happening, and so sometimes they can do that. And in this case, that is what happened. So when we got the letter, my mom called and got one of the other providers as her, new doctor to check in with every year. And she followed up after the mammogram in August and said that she would see her in April and that, she noticed there was an MRI in February, but that's not necessarily a standard. Was that something my mom still wanted to do, or did she want to change it to maybe a regular mammogram, or just skip it and see her in April and kind of go from there? And at the time, I just suggested to my mom that whatever the surgeon usually tells me is what I end up following to a T. A lot of people call me rebellious when it comes to the medical community because I've done things that I'm not supposed to do, and I definitely would not suggest anyone else do it. But when you've been dealing in the medical world as long as I have, sometimes you just need to be a little bit of a rebel, okay? But that being said, when it comes to what the surgeon tells me, I follow that exactly. So I told my mom, just keep your MRI appointment, just follow, like Dr. Maggiorano said, it'll be fine. And so last week we got the results and something did show up. And so it's standard procedure then to schedule a biopsy. And it can take a while to get that biopsy. And keep in mind that usually the results of a biopsy take about 2 weeks. So when you call to get in, sometimes the people who are scheduling you aren't as motivated as you, the patient, are. And you have to do your best to communicate that in a very kind way. I work in a medical office. I have received all kinds of phone calls on the spectrum. And so when I'm calling to try to get an appointment as soon as possible, I try to just suggest that, I have some urgency, if there's a wait list, if there's any other location I can go to. And usually then the scheduler gets an idea that I would like to get one as soon as possible, kind of deal. So in this case, we were able to get one 2 weeks, which is pretty good, I would say. And so we've got that up and coming. And as I've said in other videos, because I'm so used to so many different surgeries and biopsies and test results, I'm really good at going in kind of that mode of what do we need to do? Like, let me track down that old surgeon in case we need her. Let me get that biopsy scheduled as soon as possible. Let me make sure that she understands all the instructions because there are things that you need to stop taking before some procedures and tests, and this is one of them. And I also have to remember that when she had that surgery in 24, that was only the third surgery she ever had. And I am well past counting on my fingers and toes how many surgeries I've had. And so last week was challenging because she was going through quite the emotions, which is completely understandable. And everybody gets information and processes it differently and being respectful of that. But I wanted to be there for her for when she needed me in those moments. And that is the reason why I did not get last week's video done. There was a lot up in the air, but we've got things scheduled, we've got a plan. She's doing much better as far as the waiting, because of course that's the worst part is not knowing, right? I've had so many different biopsies that turned out benign, but I know what it's like when you're just counting the days until you get the biopsy, counting the days until you get the results. Back in the day when we didn't have my chart, you actually had to wait for your doctor's appointment to get the results. So there's a lot of waiting in this, right? And you just want to hurry up. Let's find out what it is and what do we need to do, because life doesn't necessarily stand still while you're waiting for medical stuff. So that can add to the stress of the moment. And so I just kind of wanted to share what was going on with our process and how we came about it, because I would only imagine in some cases people aren't following up like maybe they could. And maybe there are questions that you bring up to your doctor if you've been in a similar situation, just to make sure you have all your bases covered, especially if it's something that your insurance allows. You pay for it, you might as well get the test done and just make sure everything's right. So I hope you got something out of this and look forward to another video. And I hope you guys have a great rest of your week.